These are the muscles of the vertebral column. So there are some muscles attached to the posterior part of the vertebrae, and some are attached to the anterior part of the vertebrae. The ones that are attached to the back of the vertebrae, these are called the spinal extensors or rector spinae muscles. This is important for posture and body position, so that's causing extension of the spine. There's two different layers. One is called superficial layer and the other one is the deep layer. Superficial layer is made of three muscles, medial to lateral. One is called the spinalis, the other one is called longissimus, and the third one is called iliocostalis. So medial to lateral. Then is that the deep layer is made of two big muscles and three smaller muscles. So semispinalis and multifidus is the bigger muscles. I will show it to you in the next slide. And then you have the three smaller muscles that I can show you to here in this image. So one is called the interspinalis muscle, this one. So the flexion of this causing extension of the spine. So contraction of this muscle causes extension of the spine. This is called rotators, that is connecting the spinous process to transverse process of vertebra, and that is cause rotation of the vertebrae. And this muscle is called Intertransversarii, and this is connecting the two transverse processes of the vertebrae. You have a different image in your textbooks, a little bit complicated. This image is very simple and straightforward, so I put this image. You can also look at that image from your textbook. So let's look at those muscles. So there's three of them that I said is superficial. This is called spinalis, and when this muscle contracts, it can cause extension of the vertebrae. Then you have the second muscle lateral to the spinalis. This is called longissimus. This is longissimus thoracis, cervicis, and capitis. And if both of them contract at the same time, cause extension. And if one of them contracts, that can cause flexion of the spine to that side. Then is lateral to longissimus, you have the iliocostalis. So you have iliocostalis lumborum, so from the lumbar area, iliocostalis thoracis, and iliocostalis cervicis. So flexion of this muscle cause, or I should say contraction of this muscle causes both of them together. If they contract at the same time, it can cause extension of the vertebral column. The deeper muscles, semispinalis, so you have semispinalis thoracis, cervicis, and capitis, and when they contract, that both of them contract, that will cause extension of the spine, and then one of them contracts cause rotation. Depends on the location. This part may elevate the rib area, and this stabilizes the rib area, and this area will cause depression of the ribs. So it depends on the area, but the main function to know for semispinalis is extension of the spine or vertebral column. You also have the multifidus. This muscle, this is also cause extension of the spine. And then you have a couple of other muscles there that I put it in gray because these are not rector spinae muscles. One is called Quadratus lumborum, and this is cause flexion of the spine. And also this is external oblique, that I will come back to this, I will show it to you, and that's also an abdominal muscle. So another muscle group is called flexor spinae or spinal flexors, and the couple of muscles here, one is called longus capitis. If both of them contract, it will cause flexion of the spine, and in that area is flexion of the neck. And if one of them contracts, it will cause flexion to that side. And also you have the longus colli, and this is the muscles that can cause flexion of the spine in that area. Another spinal flexors is the quadratus lumborum, which I showed you in the previous image, and again, same idea here, causing flexion of the spine. Some other muscles that was not showing there properly, so I added here this image. So this is splenius muscle. So splenius muscle cause extension of the spine in that area, and this is a more superficial muscle. If you deeper to that, if you can dissect this area and deeper to that, you have Semispinalis capitis muscle, which is again an erector spinae muscle. And these three muscles that you see, these are also erector spinae muscles. So Spinalis, Longissimus, and Iliocostalis. So it's just the same muscles, but they are different view. Okay, and you also have these muscles that you can see. These are called serratus posterior and inferior, that brings the ribs downward. And these muscles that are not labeled here, you can write it down if you want. That's called serratus posterior superior. Okay, so just the same muscles groups, but a little bit different location, and this one causing elevation of the ribs. Okay, so this one caused depression of the ribs, and this was elevation of the ribs. Serratus posterior superior. Also, you can see some of the abdominal muscles here. So this is internal oblique, and this is the external oblique, and I will come back to those muscles later.